Thank you, President. Also to ask the Scottish Government what dialogue it has had with NHS Greater Glasgow and Clyde regarding shared care agreements for adults with private ADHD and autism diagnosis.
Cabinet Secretary Neil Gray.
Thank you, President Officer. My officials were in communication with NHS Greater Glasgow and Clyde regarding shared care agreements for adults with private ADHD and autism diagnoses in November. Colleagues in NHS Greater Glasgow and Clyde provided their policy and their approach to private diagnosis. Additionally, the Director of Mental Health wrote to the Chief Executives of all health boards in March with a baseline survey of neurodevelopmental assessment and support for adults available locally. This included a question on protocol when approached by an adult with a private diagnosis that wishes for this to be ratified by the NHS.
Stuart McMillan.
I thank the Cabinet Secretary for that reply, and it has been repeatedly raised with my office and myself that adults in my constituency feel like they have no other option than to pursue a private ADHD or autism diagnosis in instances where they are given a diagnosis and are prescribed medication. Trying to get an NHS shared care agreement in place is the next challenge, and for many this can result in huge financial bills which they risk not being able to afford if the NHS doesn't take on their treatment. So can the Cabinet Secretary therefore advise what additional work is to take place to ensure that the criteria for NHS shared care agreements is made clear to patients, and that the process for assessing whether a private diagnosis meets NHS standards is carried out at pace?
Cabinet Secretary.
Thank you, President Officer. I thank Stuart McMillan for raising this on behalf of his constituents, who I absolutely sympathise and empathise with. There has been an increased awareness of neurodevelopmental and divergent issues for adults, which has seen a growing demand upon services, and that poses challenges that we're seeking to respond to. Some NHS boards may have shared care policies, but it remains at the clinical discretion of each individual GP to decide the best course of action for their patients. A recommendation from a private specialist for a particular medicine does not entitle the patient to NHS prescriptions for that medicine. However, the National Autism Implementation Team published guidance on prescribing ADHD medication to adults following a private sector diagnosis in Scotland in April 2022. This guidance is available to practitioners and to patients, and officials are engaging with the Royal College of GPs here in Scotland to understand more about what could be done to ameliorate the situation of private diagnosis of ADHD and voluntary agreements.
Brief supplementary, Willie Rennie.